Beverly, thank you again for your welcome to country, and I would like to also acknowledge the Noongar elders, the traditional owners, both past, present and future, of the land on which we stand today. Can I also please recognise a number of people here today who, without their contribution, this event would not be possible. To Forum founder Maria Halfin, President of the French-based Philippe and Maria Halfin Foundation, the foundation and primary funder of the Forum. It was a joy to meet you earlier on when this was becoming a reality. Former WA Health Minister Keith Wilson, and I would just add that when I did become a health administrator, Keith was the Minister for Health, so we have had some previous times together. My parliamentary colleague in Simone McGurk, Dr. Norman Swan, journalist and ABC Radio National Health Report broadcaster, Professor Norman Sartorius, former head of the World Health Organization Division of Mental Health in Geneva, Associate Professor Itamar Khan of Israel's Technion University, Professor Philippe Fossati, ICM, Brain and Spine Institute at Paris, Professor Ian Hickey, Director of Brain and Mind Institute of Sydney, Professor Julio Lucinio of the South Australian Mind and Brain Institute, Professor Fiona Stanley, Founding Director of the Telethon Institute of Child Health Research, Professor Jeff Gallop, former Premier of Western Australia, Heath Black, former AFL footballer, Lynn Mahboub, Manager Hearing Voices Network in Australia. And again, thank you so much for the opportunity to be here and open the inaugural meeting of Mind's Mental Health Forum. On behalf of the West Australian Government, it is my pleasure to welcome eminent interstate and overseas scientists, clinicians, and those with a lived experience of mental illness, their carers and families to our beautiful state. This forum is an outstanding achievement of Maria Halfin and Keith Wilson, whom I met with on a number of occasions to discuss the forum's concept. I've followed with great interest the evolution of an initial idea into a meeting of some of the most talented and world-renowned minds in the area of mental health. The organisers have chosen a great venue in Fremantle for the minds to meet, and I hope that you'll be able to take some time to enjoy the beautiful beaches, the unique flora and fauna, and the local and fresh cuisine. This forum presents a unique opportunity for collaboration between international, national, and local scientists, clinicians, and those with lived experience of mental illness. It brings together streams of professionals that have not assembled before to look at new and groundbreaking areas of research. It could be likened to the brain versus mind debate, which until recently has meant research has gone down one of those paths as opposed to seeking new ways to bring these two essentially inextricable concepts together. The brain line of research has concentrated on neurotransmitters, neuronal pathways, neuroimaging, neuroplasticity, and has focused on medications and medical treatment, while the mind line of research has focused more at the psychological experience, the social context, life experience and trauma to inform counselling, psychological and more recently recovery and peer support approaches to treatment. This conference provides us with the unique opportunity to challenge perspectives and bring the brain versus mind experts together in order to realise they both have common ground. Encourage and coordinate interdisciplinary clinical mental health research. Discuss and review key concepts surrounding mental health and come up with a new way forward, one that demands us to look at the individual as a whole. I hope the workshop discussion style of the meeting for the Minds Forum will encourage you to forge new partnerships as you link emerging insights and lay the groundwork for real progress, both here and overseas. It's been suggested that the absence of significant breakthroughs to improve treatments and therapies in mental health over the past decades has been frustrating to consumers, carers, families, and clinicians alike. This must especially be the case when they witness the great strides being made in the treatment of diabetes, hepatitis C, breast cancer, heart disease, eye disease, blood cancers, epilepsy, and so on. How wonderful it would be if we had at our fingertips an internationally agreed, evidence-based protocol or practice framework that outlines exactly what the best way is to treat and support people with different diagnoses of mental illness. If clinicians and support workers did not have to rely on using trial and error, but rather all worked from an agreed protocol, a protocol laying out step by step all the treatment and support requirements needed to provide the best possible chance for a person to reach their recovery potential. The opportunity this forum provides to discuss and debate emerging topics, including new therapies, links between brain dysfunction and psychoses in young people, and ways to increase life expectancy, I believe, is essential. We cannot postpone any longer the search for breakthroughs in these areas, and we need to continue to meet and work towards solutions until we get there. It is my hope that discussions at this event will open up new directions for research, leading to the scientific evidence we desperately need in this area, and thus improve the quality of life for people affected by mental illness. I know Keith Wilson, the previous Health Minister for Western Australia, would agree with me that we have a long way to go in Western Australia in the area of mental health service provision. He and I have a particular interest in this area and have dedicated much of our political careers to trying our very best to reform mental health services. As a result of these efforts, I can confidently say that we're heading in the right direction. By way of example, in 2010, the state government commenced a major reform to the way mental health services are managed, and delivered by appointing Western Australia's first Minister for Mental Health, which was not me, and establishing Australia's first Mental Health Commission. The Western Australian Mental Health Commission remains unique in Australia, in that it's the only commissioning commission, something I consider essential if we are to truly make a difference to the delivery of mental health services in our state. As such, the Mental Health Commission purchases efficient and effective services across government, private and the not-for-profit sector to meet demands and achieve meaningful and innovative outcomes. This may be at the clinical level, such as through public health, mental health services, or through the commissioning of community support services. The West Australian Mental Health Commission has established itself as a key driver of mental health reform in Western Australia through progressing purchasing, contracting and partnership arrangements with a broad range of agencies, including in the areas of health, education, training, police, justice, housing, disability services and Aboriginal-specific services. Our objective is really simple. To encourage and support people who experience mental health problems or mental illness to stay in the community, out of hospital, and to live a meaningful and productive life. To do this, we need to focus on more person-centred approaches, such as increasing access to individualised funding and including families and carers in treatment decisions. We need to put choice and control into the hands of individuals and enable them to seek out the services and supports that they would like to access. We also need to make sure we achieve balanced investment across the lifespan, across demographics and geographical areas, as well as invest in prevention and promotion through to early intervention, treatment and long-term care and support. The West Australian Government is committed to enabling self-directed supports and services for people with a lived experience of mental illness and has made significant progress in this area. Central to this commitment is the involvement of people with mental illness, their families and carers in co-designing and tailoring services and supports to what each individual needs. In 2011, the Mental Health Commission introduced the Individualised Community Living Strategy. The strategy assists people with severe and persistent mental illness to live in their own homes in the community, supported by a negotiated individualised funding package, providing tailored supports and services. By 2015-16, we expect 148 people with individualised funding to be supported to live in the community through this strategy. In 2013, a further major development occurred when the West Australian Government signed an agreement with the Commonwealth Government for a 2-year pilot of the National Disability Insurance Scheme, otherwise known as NDIS. Under this agreement, 2 approaches for the delivery of self-directed supports and services for people with disabilities, including people with a long-term disability related to their mental illness, will be trialled in Western Australia. The 2 approaches are the Commonwealth-run NDIS model, which will be launched in the Perth Hills area on the 1st of July this year, and the state government's My Way model, which will also be implemented on the 1st of July in the lower southwest with the Coburn-Kwinana site from the 1st of July 2015. More than 8,000 individuals in Western Australia will be progressively included in the NDIS and My Way models over the trial period. With 1 in 5 adults and 1 in 4 young Australians experiencing a mental illness each year, mental illness is everybody's business. Prevention of mental illness and suicide is a community-wide concern that requires a coordinated approach across the whole community. I have likened the rate of suicide and self-harm we are seeing as a public health crisis, like an epidemic of a communicable disease. We would not stand for 1 death per day from a disease such as polio or something of that nature. So why do we stand for it in the area of suicide and self-harm? We need a coordinated community health, public health, or whole of population response to this crisis. I believe we need to seriously look at how a public health response can be applied in the area of suicide and self-harm, including contact tracing, quarantining, etc., perhaps via and quarantining from the social media. A key focus of the government has been increasing community awareness of suicide prevention and the role we all play, mums and dads, workmates, teammates, friends and families, neighbours, in understanding the signs and symptoms and the foundations of good mental health and ensuring problems are identified and addressed early. But again, more needs to be done. A key platform in the reform of the mental health system in Western Australia is the Mental Health Bill, which was mentioned and is currently before the upper house of the Parliament of Western Australia. The introduction of the bill into Parliament represents the culmination and consultation and substantial community stakeholder and expert feedback. It will bring our state's legislation in line with current best practice in mental health, including by reflecting principles of recovery for those living with mental illness. The bill goes to considerable lengths to improve the lives of people living in Western Australia who experience mental illness. Some examples of key changes include the improvements to the protection and rights of people with a mental illness. I've got a few extra notes here. New requirements to safeguard people with a mental illness in recovery, and a greater focus on the role of carers and the families of people. The extra notes I've written down are that during the debate on this bill, once again, I will be asked to explain how ECT works, the evidence of its efficacy, and again I will have difficulty, even though I know it does. I've been there while people have experienced ECT. A similar conversation and a similar requirement will be made of me and a similar conversation is needed, and community education is needed around psychosurgery and the emerging techniques of deep brain stimulation, all of which are regulated in the bill. The community wants to hear from the experts, the clinicians and people with experience for using these treatments for recovery, not necessarily from politicians, but I need to hear from you. Another piece of work is the development of the West Australian Mental Health and Alcohol and Other Drug Services Plan. The plan is based on the National Mental Health Services Planning Framework. The framework was the result of a national project undertaken to identify the type and number of treatment and support services that are required per 1,000 head of population. It draws on evidence, expert opinion, demographic data and so on, and has been used by a number of states to provide a blueprint of what is required, where, how much and so on. Here in Western Australia, the development of our own plan has involved hundreds of clinicians, consumers, carers and other support workers. These people have helped to design the future of mental health services and system in Western Australia using this normative framework, but also informed by felt, expressed and comparative data. I'm very much looking forward to receiving the plan in the next month and seeking government's endorsement. Since 2008, investment in Western Australia's mental health services has grown by 68%. While more investment is good, and the new 136 new and replacement acute beds under construction are welcome, it's not enough on its own. Hospitalisation should not be the first option when people with mental illness need extra support. As a government, our aim is to provide access to more innovative and better quality community services and supports. This helps promote recovery and social inclusion. There is a shift in thinking towards more individualised approach to service delivery and design. A few examples of this are the development of community-based step-up and step-down subacute services, offering the flexible recovery-focused care options for people with mental illness closer to where they live, whilst also reducing pressure on crowded hospital inpatient beds. And in Western Australia, we're slow off the mark in that area of work. The development of the mental health court diversion and support programs which divert people with mental illness who interact with the criminal justice system into clinical and community supports. The statewide Specialist Aboriginal Mental Health Service provides a range of treatment and support services to Aboriginal people with severe and persistent mental illness. In addition, the Mental Health Bill 2013 will also give Aboriginal and Torres Strait Islander people greater support from their communities while receiving treatment for mental illness. People of Aboriginal descent will have the opportunity to receive treatment, care and support in collaboration with Indigenous mental health workers and significant members of a person's community, including traditional healers and elders. In the next 3 years, the Child and Adolescent Mental Health Service will focus on Aboriginal children and young people through strengthened collaboration with other Aboriginal agencies. However, I am sad to say in Western Australia we also have one of the last centralised, institutionalised, standalone psychiatric hospitals in Australia. I very much look forward to transitioning services from this archaic setting towards services closer to where people live, and I can confidently say that this transition is high on the agenda of government. The final area I would like to highlight is the need of children, young people and their families who are experiencing a mental health crisis. This is an area that desperately needs more attention. I believe we should do everything possible to keep these children out of hospitals. We must keep our young people at home with their families, at school, participating in social activities, whilst having the most appropriate treatment and supports in place to assist them to recover from a period of mental illness. This is a high priority of mine, and I hope today it will be a high priority of all of us. I understand it is hoped that this meeting for MFM Forum will become a biennial event, promoting ongoing conversations, research and evidence-based practice. You, the clinicians, the consumers and carers must come up with the solutions and be able to confidently advise governments across the world what services and treatments work best, in what circumstances and in the different areas of mental health. As politicians, we need you to tell us where our focus should be, what is best practice, and what does the evidence tell us regarding the best investments a government can make. In Western Australia, our shared understanding or vision is for everyone to work together to encourage and support people to live in the community, stay out of hospitals and have these meaningful, productive lives with good jobs, great responsibilities, strong families and relationships, and making a real contribution to society. I hope this is your shared understanding too, and I look forward to the outcomes of this shared understanding that will bring to the lives of people with a lived experience in mental illness. And it really does give me great pleasure to officially open Meeting for Minds.